Benign prostatic hyperplasia and prostate cancer are two of the most common conditions that affect men's prostate gland. In both cases, the gland becomes enlarged and can cause problems with urination. BPH and prostate cancer share similar symptoms, so it's sometimes hard to tell the two conditions apart. While many prostate cancers grow slowly and may not cause serious harm, some types are aggressive and can spread quickly. Prostate cancer that's detected early, when it's still restricted to the prostate gland, has a better chance of successful treatment. So, what exactly is prostate cancer? And what are the warning signs you should look out for? Well, keep watching because in this video we're going to talk about some of the most common symptoms of prostate cancer that every man should know. While these signs don't necessarily mean you have prostate cancer, it's always better to be informed and seek medical advice if you experience any of them. So, with that said, let's get started. First, let's understand what prostate cancer is and what are the risk factors associated with it. Well, in simple terms, prostate cancer is a type of cancer that occurs in the prostate gland, which is a small walnut-shaped organ located just below the bladder and in front of the rectum. This gland produces some of the fluid in semen and plays a vital role in the male reproductive system. On the other hand, benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland that affects almost all men as they age. As with any other type of cancer, prostate cancer occurs when some cells in the prostate gland start to grow abnormally and form a tumor. Over time, these cancerous cells can spread to other parts of the body if left untreated. In its early stages, prostate cancer may not cause any symptoms at all, making it difficult to detect. However, as the gland grows larger, it can start to press against the urethra, causing problems with urination. The exact cause of prostate cancer is still a mystery, but there are certain risk factors that can increase a man's chances of developing this disease. These include age, family history, race, specifically black people, obesity, tobacco smoking, and exposure to certain chemicals. Now that we understand what this type of cancer is and what can put us at risk, let's look at some of the warning signs to watch out for. So, the first symptom is frequent or urgent urination. This is one of the most common signs of prostate cancer and should not be ignored. If you find yourself making frequent trips to the bathroom, especially at night, it could be a red flag. This is because as the tumor grows larger, it starts to put pressure on the urethra, which can interrupt the normal flow of urine. This leads to an increased urge to urinate, even when your bladder isn't full. While it may not look like a serious problem, frequent urination can have a significant impact on your quality of life. It can disrupt your sleep and leave you feeling tired and irritable during the day. In some cases, it may also lead to other complications, such as urinary tract infections, bladder stones, or kidney damage. Well, age and other factors can also cause frequent urination or urgency, but it's always better to be safe than sorry. If you experience this symptom, don't brush it off as a normal part of aging. Consult your doctor for further evaluation to rule out any underlying conditions, like prostate cancer. The next warning sign is difficulty with urination. Aside from frequent urination and urgency, prostate cancer can also cause difficulty with urination. This includes a weak or interrupted urine flow, straining to start or maintain the flow of urine, and feeling like the bladder is not completely empty after urination. It can also cause a burning sensation or pain during urination. These symptoms occur when the prostate gland becomes enlarged and blocks the urethra, making it difficult for urine to pass through. People with prostate cancer may also experience dribbling or leaking urine due to the obstruction caused by an enlarged prostate. These manifestations can also be caused by other conditions, like urinary tract infections or an enlarged prostate due to aging. But it's important to get checked by a doctor for a proper diagnosis. In some cases, it may require the use of a catheter to empty the bladder. So, if you don't want to deal with such unpleasant symptoms, Seek medical attention as soon as possible to avoid such complications. Another warning sign is blood in the urine or semen. In the early stages, prostate cancer may not cause noticeable changes in urine or semen. However, as the disease progresses, it can damage blood vessels and cause bleeding. Hematuria, blood in urine, or hematospermia, blood in semen, are the two types of bleeding that can occur in men with prostate cancer. Most cases of hematuria are not severe, as they may be caused by heavy exercise or certain medications. However, in some cases, blood in urine or semen can be a warning sign of other serious conditions like cancer, UTI, or kidney disease. If you notice any changes in the color of your urine or semen, first don't panic and try to stay calm, because it doesn't necessarily mean you have prostate cancer. But if this bleeding persists or is accompanied by other symptoms, make sure to see your doctor for a proper diagnosis and treatment. You may also experience painful ejaculation. Prostate cancer can sometimes also cause pain during or after ejaculation. This pain may be felt in the penis, testes, rectum, or even the lower abdomen, and can range from mild discomfort to severe pain. These painful sensations can last for a few seconds or even longer. This symptom not only causes physical discomfort, but can also have a significant impact on sexual pleasure and intimacy. Besides this, prostate cancer can also cause erectile dysfunction, which can further affect your sexual life. While it is not a topic that any man would feel comfortable discussing, it's important to address these symptoms and seek medical attention if they persist. The last warning sign is pain in the hips, back, or chest. As we mentioned earlier, prostate cancer can also spread to other parts of the body, so it's not just confined to the prostate gland. When cancer cells invade nearby tissues or bones, they can cause pain in the hips, back, or chest. This usually happens in the advanced stages of the disease, when the cancer has already spread beyond the prostate. The pain may start as a dull ache and progress to a sharp or throbbing sensation, depending on the severity of the condition. It can also be accompanied by other symptoms, such as difficulty walking or standing, weakness in the legs, or loss of bladder or bowel control. If you have been experiencing pain in these areas for an extended period, it's crucial to get checked by a doctor to determine the underlying cause and receive proper treatment. So, what can you do to protect yourself from prostate cancer? Well, as with any other type of cancer, early detection is key to successful treatment and recovery. Therefore, if you experience any of the above warning signs or have a family history of prostate cancer, it's crucial to get regular checkups and screenings to catch it in its early stages. As we said before, early detection can significantly increase your chances of survival and improve your quality of life. Apart from that, try to maintain a healthy lifestyle and diet. Instead of red meat, processed foods, and sugary drinks, focus on a diet rich in fruits, vegetables, whole grains, and lean proteins. You can add certain foods like tomatoes, broccoli, berries, cold water fish, and green tea to your diet, as they have anti-cancer properties. But diet alone cannot prevent prostate cancer, so make sure to stay physically active and maintain a healthy weight. Regular exercise can also help reduce your risk of developing prostate cancer. Moreover, avoid smoking and limit your alcohol consumption, as they are known to increase the risk of various types of cancer, including prostate. Again, we want to clarify that having these symptoms does not necessarily mean you have prostate cancer. But if they persist or are accompanied by other unusual changes in your body, make sure to see a doctor for proper diagnosis and treatment. Remember, by taking care of your health and being proactive, you can protect yourself from prostate cancer and lead a healthy and fulfilling life. We really hope this video has provided you with valuable information about prostate cancer and its warning signs. If you find it helpful and want to see more health-related content, please hit that like button and subscribe to our channel so you never miss out on any of our latest videos. Until next time, stay healthy and take care.